Hi everyone, I just want to give you guys a quick apology as there is currently a tree cutting company in my backyard. They were supposed to be gone by today, but it got delayed a lot longer than it was expected to. So there is nowhere else in the house that I am able to run to do this speech besides my car. So I hope this works, but let's get started. So the speech that I chose to do today of my informative speech is a topic that I found to be quite interesting, very personal and relatable to me, and I know that this topic might be relatable to many others, and maybe even some of you guys might be going through this right now. So I hope this speech teaches each of you a couple things. So the topic that I decided to do is Alzheimer's. And as you know from my previous speech, I am a CNA working with residents who are dealing with Alzheimer's. So even though we do get training on the job about the disease, I actually found quite a lot of information that I never knew about the disease prior to doing this speech. So I think that this proves that even though you might think that you have a pretty good knowledge and background knowledge of a topic, you might be surprised at what you would find when you do some research. So I hope that you guys will learn a couple things, and maybe in the near future or anything, you might be able to teach others about this topic. So let's get started. So, Alzheimer's is a type of dementia that causes problems with memory, thinking, and behavior. Usually people just assume Alzheimer's and dementia are the same thing. It's memory loss, people forget things, and that's it. Well, it's almost like an old age relatable disease, but it's not. Symptoms usually develop slowly and worsen over time, becoming severe enough to interfere with daily tasks. People tend to mix up dementia and Alzheimer's or assume they're the same thing. So that's usually the two most common things that people throw around, thinking that it's the same thing. Alzheimer is actually the most common form of dementia, which is a general term for memory loss that is irreversible. Alzheimer's accounts for up to 80% of dementia cases, which means Alzheimer is the number one leading type of memory loss as dementia. Now, this is not a normal part of aging, as many people might assume, when someone gets old, they tend to forget things. But there is actually a fine line between old age relatable memory loss and Alzheimer's dementia memory loss. It does worsen over time, and there is currently no cure for this disease. So hopefully after this speech, you guys might be able to tell the difference between, or at least think you might know the difference between dementia, Alzheimer's, memory loss, and old age memory loss. So it is estimated that more than 5 million Americans have Alzheimer's disease. This number doubles every 5-year intervals between the age group of 65 and above, which means currently there's about 5 million people with this disease, and in 5 years that number is going to double to 10 million. Almost 2/3 of Alzheimer's patients are women, so that makes up a lot of that people. In order to get a clear understanding of how big this number is, the risk of developing breast cancer in women is 1 out of 11, while the risk of developing Alzheimer's is 1 in 6. So the risk of actually getting dementia, Alzheimer's, is a lot higher than what you would be to get breast cancer. Every 6 seconds in America, someone develops Alzheimer's. As for the mortality, Alzheimer's is the number 6 leading cause of death. This means there are approximately 500,000 people dying each year from this disease, in which 1 in 3 seniors die because of this. So, how can a person live with this disease? Alzheimer's is a slow progressing disease with many stages. The time a person is able to survive with this disease varies from 3 years to 10 or more years, depending on their age and stage in which they are diagnosed. So, normally, if someone is diagnosed at the age of 65 and above, the years kind of aren't looking too good. And if you are diagnosed at the age of 80 and over, usually that time period of years is usually between 1 to 3 years, more on the 1 to 2 year range. Now, Alzheimer's is not just a disease of old age. Younger onset Alzheimer's affect individuals under the age of 65. This could even include individuals in their 30s. So, most people usually assume Alzheimer's with old age, but like I said, this is not necessarily the case at all times. So, there are 7 stages of Alzheimer's disease. Stage 1 is no impairment with normal function. Stage 2 is very mild cognitive decline with normal age-related changes or earliest stage of this disease. This stage will include forgetting names or location. So it's just the start of this disease, and it's little minor things that seem to be forgotten. Stage 3 is mild cognitive decline with early stage dementia. This includes notable impairment with increasing trouble with planning or coming up with the right words. So typically you would see this between stage 2 and stage 3 is when most people would be diagnosed with the disease. Stage 4 is moderate cognitive decline with mild Alzheimer's disease. This includes challenges with daily living and memory lapse of recent events. Stage 5 is moderate severe cognitive decline with mid-stage Alzheimer's. This includes the need of monitoring daily living and memory lapse of personal details such as address and phone number. Stage 6 is severe cognitive decline with mild stage Alzheimer's. This includes supervision and assistance with daily living, tendency to wander around, and memory lapse of families' names. Stage 7 is the last stage of Alzheimer's, and it's a very severe cognitive decline. This includes total assistance with feeding, toileting, mobility, and it's generally non-verbal. At that point, usually at stage 7, the person do not respond well to anything. Now, this disease has its effect on the mind and body. Memory problems are typically one of the first signs. The individual soon will have problems recognizing families and friends. As the damage occurs in different parts of the brain, simple functions such as speaking, writing, thinking will slowly deteriorate. Personalities and behaviors also change as part of the progression. Individuals may seem selfish or rude due to the lack of capable of knowing what is right from wrong. They also have experience isolation, usually it's in the beginning when they are aware that they are having difficulties when they are placed in an environment with people. So what this means is they might know that in the early stage, they might know that they're having a hard time having a conversation, or difference between what a fork and a spoon might be, and they're just embarrassed to be around people, so they tend to isolate and become depressed. Alzheimer's disease leads to nerve cell death and tissue loss throughout the brain. Over time, the brain shrinks dramatically, affecting nearly all of its function. Plaque forms when protein pieces clump together in the brain. This surrounds the nerve cells. These clumps block cell-to-cell signaling, and in addition, tangles destroy a viable cell transport system made of proteins. Nutrients and other essential supplies can no longer move through the cells and eventually die. The plaque and tangles tend to spread throughout the cortex in a predictable pattern as the disease progresses. There are factors that increase the risk for Alzheimer's. The most important risk factor includes age, family history, and genetics. Back in the 60s and 70s, people thought that aluminum was a possible suspect in causing the disease. Now, this was before we had the technology and research. So this was led to concern that everyday exposure to aluminum, such as cooking pots, foils, cans, and any other products with aluminum, is the leading cause of dementia, but it has since been proven wrong. Alzheimer's is diagnosed through a complete medical assessment. There is no, however, one single test that can show whether a person has Alzheimer's. Some tests may include a detailed questioning of overall and family health history, test of memory, problem solving, blood and urine test, and brain scans. The only definite diagnosis of Alzheimer's disease can be made through an autopsy after death, and that is the only absolute way of telling. Prior to that, there's only scans and blood work to tell whether someone might be having symptoms of Alzheimer's. This is done by linking clinical measures with an examination of the brain tissue. Even though there is no cure for disease, there are some medication that can help with the symptoms. Drug and non-drug treatment have helped both the cognitive and the behavioral symptoms. However, these medications have proven to change people's personalities, and as a first-hand witness to this, I have seen medication change a person, and it's hopefully one day we will find a drug that will help Alzheimer's. Now, Alzheimer's does not only affect families, but also caregivers. As a caregiver myself, I fully understand the responsibility and stress it can have on each person. Family members also turn to us for support and comfort in hard times. After all, we are their second family, and we do sometimes know the patients better than their families do. More than 60% of caregivers to Alzheimer's are women. The rate of emotional and physical stress as caregivers is rated as high or very high, and more than 1/3 have reported symptoms of depression. However, help is always available for family members and caregivers at all times. There are websites providing extensive amount of information, such as the Alzheimer's Association. Support groups are just about anywhere. There are numerous support groups available online, such as message boards and chat rooms. These are available 24 hours a day, and they are typically around the world. Support groups can also be found by location within different states. So people are able to get together and to talk about their problems and support each other through hard times. And also, financially, people are able to support themselves with this because in order to care for someone with Alzheimer's, it can put a burden on a family's income, and there are websites where you can get emotional and financially supportive people. This information is also available on the Alzheimer's website. 24-hour hotlines are also available for anyone who wishes to speak to a professional. And this is the number. Right there. So typically at work, we tend to get a lot of Alzheimer's and dementia goodies, and we do have also at my work, we also have family nights where people are able to get together. So it's almost like we have our own support group there. So overall, I hope this was an interesting topic to each and every one of you, and I will provide the websites available for support groups and helps. And if you ever want more information to research more about this disease, I will provide the information. So thank you.